Hi, I'm Allison Massey, registered dietitian and certified diabetes care and education specialist. Today, I want to talk a little bit about GLP-1 medications, a medication class that many of my patients that I see in clinic are prescribed. GLP-1 medications mimic a hormone that the body naturally makes. These medications can lower blood sugar, help regulate appetite, and even promote weight loss, and some have heart health benefits as well. So, while you take these medications to get the most benefit, there are a few food and nutrition and lifestyle tips that you should keep in mind. Here are my top 4 tips to keep in mind when you're taking a GLP-1 medication. Tip number 1, focus on smaller and more frequent meals. One of the common side effects of GLP-1 medications is that you may feel full sooner and gastric emptying is a lot slower. Eating large meals is just not ideal. So focus on developing a meal pattern where you're eating smaller and more frequent balanced meals and snacks. Tip number 2, focus on adequate fiber and fluid intake to keep things moving. As I mentioned previously, gastric emptying is a lot slower when you're on a GLP-1 medication, which means that constipation is a common side effect. To avoid that, get ahead of things by adding a lot of naturally high fiber foods. Things like berries, avocado, broccoli are great to include in your diet regularly. Top that with a lot of extra fluid. Focus on low-calorie options. Water is always best. Tip number 3, get moving, and specifically focus on strength training. When you're losing weight, and perhaps when you're losing weight rapidly, you're losing both lean muscle and fat mass. We want to preserve as much of that lean muscle mass as possible. So focus on integrating strength training at least twice a week in addition to cardiovascular exercise. A good goal is 30 minutes 5 times a week. If you're starting out, take it slow and steady and just build on where you're at, adding extra time and maybe even extra movements or extra weight as you're able. Tip number 4, last but not least, really focus on creating balanced meals. I mentioned this before, but use kind of the plate method as a guide. You want to focus on eating your lean proteins and vegetables first at meals, and then your high fiber complex carbs last. Portion control is key, but the GLP-1 medications do often help you regulate your portion or your appetite control a little bit more. Talk to your healthcare provider about more specific and customized diet and nutrition and exercise guidance that's specific to you when you're prescribed a GLP-1 medication. I hope those 4 tips help.